Hi everyone, good morning. Thank you so much for being here today. My name is Jenny Lee and I'm a community outreach specialist from Dana-Farber Cancer Institute. I'm very excited to be here with all of you to talk about preventing cancer, specifically 6 types of cancer caused by the HPV or the human papillomavirus. First, we'll go over what HPV is, what it stands for, how it spreads, and how common it is. And then we'll talk about the link between HPV and cancer, which types of cancer it causes, and why that matters. And finally, we'll talk about what we can do to lower our risk through vaccination and screening. So HPV, the human papillomavirus, is first and foremost a virus. I'm very sure that we are all very familiar with what a virus is, but at its simplest level, a virus is a tiny germ that can infect our body cells and sometimes cause disease. Some viruses you have probably heard of are there's the flu virus that caused the seasonal flu, and then the COVID-19 virus that we became very familiar in the past few years. And finally, there's the human papillomavirus, HPV, and that is what we are going to be focusing on today. So HPV is extremely common and spreads through close skin-to-skin contact. It is usually spread through sex, but you can also be exposed to HPV through intimate touching and close skin contact as well. HPV is also challenging because it often has no symptoms at all. So even though HPV is super common, most people don't know they have it or they have passed it on to a partner. So because of this, even practicing safe sex or using condoms cannot completely protect you from HPV. The good news is our body can clear most cases of HPV on its own. However, sometimes other times it could stay in the body and cause health issues, including cancer. So there are over 100 different strains or types of HPV. We break them down into these low risk and high risk categories. Most types of HPV fall into this first, low risk category. These strains can cause warts or lesions. I'm sure some of you have seen warts before, like here it's shown on the hand, and other strains of HPV can cause warts on the genitals, mouth, or throat. So when we say low risk, we definitely don't mean that they're good or they are harmless, just that they aren't life-threatening. Now let's talk about high-risk HPV. The second type of HPV and the one we are most concerned about are high-risk HPV. There are 14 strains of them or type of HPV that can cause cancer. There are no visible symptoms of this kind of HPV. So for people with a cervix, it can cause abnormal cell changes, which can be found through a pap smear, or it is also called a pap test or an HPV test. But for both low risk and high risk HPV, most cases have no symptoms at all. So this really allows it to spread around our bodies and stay silent and then show up 10 to 20 years later and cause health issues. So now we know more about HPV. I'm going to talk about the link between HPV and cancer. So we know that HPV can cause these 6 types of cancers. In the United States, about 35,000 people are diagnosed with a cancer by HPV, caused by HPV each year. That means that if we could, every year, we could almost fill a Fenway Park with people newly diagnosed with preventable cancer. For the sake of time for today, I'm going to cover 2 most common HPV-related cancers, the cervical cancer and oropharyngeal cancer. So cervical cancer occurs in the cervix, which is the lower part of the female reproductive systems that connects to the uterus. Cervical cancer is a cancer that impacts younger women, with most cases diagnosed between the age of 35 to 44. Cervical cancer, it has a 5-year survival rate of about 66%. That means that about 6 people out of 10 are going to still be with us 5 years later after their diagnosis. In the United States, cervical cancer is more common among Black and Hispanic populations than the white populations, while we see lower rates of cervical cancer among Asian, Pacific Islanders, and Native populations. Symptoms of cervical cancer can include abnormal bleeding, heavier or longer periods, bleeding after sex, increased discharge, unexplained pelvic or back pain. So everyone's treatment is different, but like other cancers, cervical cancer is often treated with a combination of chemotherapy, radiation, and sometimes surgery, including a hysterectomy. Well, cervical cancer used to be the most common cancer caused by HPV. Oropharyngeal cancer, or cancer in the oropharynx, is now the most common. The oropharynx includes the back of your throat, your tongue, and tonsils. It is sometimes also grouped in with throat cancer, or it is also called the head and neck cancer. This cancer also impacts people with the average age of diagnosis between age 40 to 55. However, unlike cervical cancer, oropharyngeal cancer is far more common in men, with 82% of cases are found among men and only 18% of cases are found in women. Most patients are treated with a combination of therapy, including surgery, external beam radiation, radiotherapy, and chemotherapy. This type of cancer also usually respond well to treatment. It had a higher survival rate than cervical cancer. So with 85 to 90% of people still be with us 5 years later. The symptoms of oropharyngeal cancer can include a sore throat that won't go away, earaches, hoarseness, swollen lymph nodes, pain when swallowing, and also unexplained weight loss. Sometimes people will get a lump on their neck. But again, other times you may have no symptoms at all, so it can be really difficult to catch it early. And also, because there is no screenings for this screening test for this type of cancer, so it is really important for us to pay attention to the symptoms or when we visit our dentist. Your dentist is trained to look for early signs for cancer, including oropharyngeal cancer. So don't skip your dental appointment. The good news about HPV-related cancers compared to other cancers is that we know exactly what causes it. And we have 2 major tools to prevent ourselves, our family, our loved ones. So it is vaccination and screening. So the number 1 best way to protect yourself or your child or your grandkids from an HPV-related cancer is through vaccination, which is given through a shot. The HPV vaccination has been shown to prevent 92% of all cancers related to HPV. So if you think back to the Fenway Park, we could prevent almost a whole stadium worth of people from getting cancer each year through vaccination. The American Academy of Pediatricians recommends a series of 2 shots spaced out over 6 months, depending on how old you are, and usually it is best to be given around the age of 9 to 12, with the other middle school vaccines. If you get vaccinated before your 15th birthday, you would need 2 shots, and after that, you would need 3. The vaccine has been shown to be less effective when we get older, so it is not usually recommended after the age of 26, but you can still talk to your doctor if you think you may be benefit. The vaccine is extremely safe, although it has the same mild effects with any other vaccine. So redness, soreness in the arm is most common, as well as some cases of nausea or fainting. The HPV vaccine actually just turned 20 years old this year, so that makes it older than the first iPhone. So since it was introduced, over 120 million people, including, have gotten vaccinated, and we are already seeing lower cases of HPV-related cancers. Among young adult women, infections with HPV types that cause most HPV cancers and genital warts have dropped for 71%. While the vaccine was initially given to girls only, it was expanded in 2014 to boys as well. Unfortunately, we are still seeing lower vaccination rates in boys, so it is really important to remember that the HPV vaccine is for everyone regardless of gender. So screening is another tool we can use to prevent cancer. Screening is when we check for early signs of cancer before symptoms start. We can screen for cervical cancer with a Pap test or HPV test. So this is when a doctor will take a swab from your cervix and then look under a microscope for any of these early cell changes we talked about before. We can catch these if we can catch these cell changes early, there are different procedures and interventions we can do to help it from progressing. This test first came out in the year of 1955, and after it was introduced, we saw the number of cervical cancer deaths have cut out in half. Today, we also have a cervical HPV test, which works just like a Pap test, so your doctor may give you both at the same time. While screening cannot stop cervical cancer on its own, it is actually another really great tool that we have, especially when you weren't vaccinated as a child. This is recommended for all women or people with a cervix starting from age 21. If your results are normal, then you are going to get tested every 3 years. If your results are abnormal, you might need to get tested more frequent. Some newer guidelines came out recently that recommend testing every 5 years after the age of 25. So it's best to start the conversation with your doctor once you hit your 20s to figure out what is the best option for you. So while this has been around for a long time, we also know that there are a lot of women and population that we are missing. First, young people. Half of the women in their 20s and 1/3 of women aged 30 to 65 aren't getting screened on time. This is super important because when you're in your 20s and 30s, you may feel healthy and not even have cancer in your radar, but this is the time those early cellular changes could be happening. Secondly, women of color, especially Black women and Asian women, are the least likely to report a recent Pap smear. Arab women and Hispanic women are also less likely to report a recent Pap than compared to white women. Lastly, gay and bisexual women are up to 10 times less likely to have a cervical screening. And lastly, the obvious group that's missing is men. Screening is only available for cervical cancer, so there are unfortunately no way to test for oropharyngeal cancer. And while we have seen fewer cases of cervical pre-cancer in women thanks to the HPV vaccine, we've actually seen cases of oropharyngeal cancer go up. In the past 20 years, we've seen cases of oropharyngeal cancer more than double. This is why vaccination is so important for everyone, including our sons and our grandsons. There are many factors that contribute to these lower screening rates. We know many people struggle to make it to their doctor appointments, especially when we are feeling healthy, because it can mean missing work, finding childcare, reliable transportation. And many people also had negative experiences in healthcare, especially people of color, which leads to mistrust. And that can discourage vaccination or going through screening. And limited English proficiency among some communities contributes to lower level of health literacy and understanding of HPV and its associated risk, resulting in reduced vaccination and screening rates. Also, stigma and fear of judgment associated with sexual health issues combined with fear of the procedure itself or judgment from the family and peers can lead to viewing HPV vaccination as unnecessary or inappropriate. This can also prevent us from having an open and honest discussion about HPV. Lastly, misunderstanding of or lack of knowledge also play a factor when it comes to HPV vaccination and screening. So it is important we know about the facts and we can protect ourselves and our loved ones. Now that we understand more about HPV, the question is, what can we do? So first, we can advocate for our own health. That means paying attention to our bodies and seeing a doctor if we notice anything unusual. Early care makes a big difference. Second, talk to your doctor, ask questions about the HPV, the vaccine, the screening, or any health concerns you may have. Doctors are there to help, and what you shared with them will be private. Taking small steps and getting information can help protect our health and the health of our family. And for anyone who may need language support, there are multilingual resources available in healthcare settings. If English is not your first language, you have the right to request an interpreter in hospital or clinics here in Massachusetts. These services are free and what you share will be private. So if you or anyone in your family or community would feel more comfortable using another language, the support is there. Some hospitals and clinics have patient navigators or care coordinators who help patients understand the screening process, schedule appointments, and follow up. They may also help with language and paperwork. So if you need support, you can ask your clinic or hospital or health center if this service is available. On this slide, we talk about some common beliefs and misunderstanding about HPV and how it spreads. So one common myth is that only people with many partners can get HPV. This is not true. In reality, you can get HPV from just one partner. Even if a partner has no symptoms, they can still carry the virus and pass it without knowing. Another myth is that HPV only spread through intercourse. This is also not true. HPV can spread through skin-to-skin, intimate contact, not just intimate activity. So the key point here is HPV is extremely common and many people can get it without even knowing. This is why prevention and vaccination are very important. Here are two more common myths about HPV. The first myth is that HPV only affects women. This is not true. HPV can affect everyone. It can cause cancer in both men and women, including cervical, penile, anal, and cancers in the throat area. And men can also get genital warts. The second myth is that only people with visible warts have HPV. In reality, you can have HPV even if you do not have any visible warts. The virus can stay in the body without showing any signs. So as we wrap up, there are three main things I want everyone to remember. First, HPV is very common. Almost everyone will get HPV at some point in their life, and most people do not know when they have it. Second, certain types of HPV can lead to cancer. High-risk HPV can cause 6 types of cancer: cervical, throat, anal, penile, vulvar, and vaginal cancers. And third, screening and vaccination can save lives. Getting the HPV vaccine between ages 9 to 26 can help protect against these cancers, and starting a PEP test starting at age 21 helps catch changes early. When we know about the facts and take action, we can prevent HPV-related cancers and protect our health and the health of our family. If you're interested in learning more about how to prevent HPV, you're welcome to scan these QR codes and access to these programs. So this is the end of the presentation. Thank you very much for everyone being here. Thank you.